is Jackie. I'll be your nurse for today. Let me wash my hands real quick. All right. If I can check your name and date of birth for me, please. Can I have your band? All right. Can you state your name and date of birth? Jane Doe 1191. Okay. All righty. Okay. So I'm just letting you know that I'm going to start a postpartum assessment on you. So it's basically checking breast, uterus, Bow's bladder, and lochia, and episiotomy laceration, and homicidal, which is CVTs in the legs, and emotional status and bonding, and possibly program. Okay. First off, I'm going to start with vital signs, if that's okay with you. This should take about like 10-15 minutes. Okay. All right. Any spiritual or cultural differences before I start? Mm-hmm. Okay. Take your blood pressure. All right, it's 120 over 80. Perfect. And then I'm going to check your pulse. All right, 80. Perfect. And your OT sat pulse ox, it says 99%, so we're good there. And then I'm going to go ahead and check for respirations. Go ahead. All right, 17. Perfect. And temperature. Say, close. All right. Okay, you can take it out. Okay, and that's 98.6. Perfect temperature. All right, and let's cover you up a little bit here. So I'm gonna go ahead and just ask you a few questions. Are you breastfeeding, baby? Mm-hmm. Yes. Okay. All right. And how often have you done it? Like you've done it? Oh, okay. Every time the baby cries. Okay. All right. No worries. Okay, so let me just check your breasts. I'm going to cover you. And what I'm checking for here is any cracks or anything with the nipples and the areola, the place where the baby's latching. All right, perfect. Okay, and then I'm just going to lightly palpate. Okay, that's okay with you. All right, no engorgement, no signs of infection. All righty, perfect. All right, let me cover you back up. All righty, so let's go ahead and down over here. Let's see here. So before I start this, I do want to talk about your breasts for a second. So you're having baby latch every time baby's crying. That's perfectly fine. If you do feel pain, because I didn't see any cracks or anything like that, but if you do feel pain or if you feel like you're getting a cut, please let us know so we can help you with the latch, okay? All right, and I'm going to go over the signs of infection in just a second, okay? Let me go ahead right here and pretend I'm going to cover this. All right, and then 1 finger length below the umbilicus, and then right here, and all right, nice and firm in midline. Did you go to the bathroom before I came in? Yes? Okay, yes. All right. Perfect. Okay, so before I get started down here, I just wanted to let you know that the assessments for the uterus, checking for the firmness, is going to be every 15 minutes for the first hour, and then the second hour is every 30 minutes, and then from then on for 4 hours it'll be every hour. But don't worry, you don't have to remember that pattern because that's my job. Okay. All right. So the signs for infection, not right now, of course, but in the future, if you do notice any redness on one breast more than the other, or any like warmth one breast more than the other, definitely let us know or call your provider. Any weird drainage from your breast, like different colors, that's like greenish or something that looks like unusual to you, definitely give a call to your provider. If you have a fever and your breasts are also engorged and big and hard, and also if you have flu-like symptoms, definitely call your provider. We just don't want to have you have mastitis, and those are some of those are signs of mastitis. Okay, so we just want to make sure we treat you guys appropriately. All right, let's go ahead and over here. Alrighty, so if I can go ahead and have you froggy legs. Alrighty, perfect. So what I'm gonna have you do here, just open your legs, relax. I know, I'm sorry. All right, we're gonna provide privacy. Perfect. There's nobody here with you, so I'm just gonna check real quick. Okay. Okay, very little bleeding. Okay, so lochia is rubra, which is perfect. Okay, and expected. It's not a lot either, but just so you know, you will have a period like going on for like 6 weeks. But if you're breastfeeding, sometimes that kind of makes it less, okay? And your periods might not come with breastfeeding if you continue doing that later on, okay? And then no lacerations. You didn't have any type of sutures going on there, so you're good to go there. It is a little bit swollen though, so just make sure you're changing your ice packs when you go to the bathroom every 2 hours, okay? Also, give yourself some break with the ice packs. Don't put it on every time. Try to give yourself a little bit of break, okay? All right, perfect. And you didn't have any hemorrhoids, so we're good there. But just to go over your bowels, I'm going to listen to them as well. And just to go over your bowel movements, you don't want to hold it in, okay? So if you need to go, definitely try to go, because then it accumulates if you keep holding it in, okay? And then it gets harder and more painful to pass, okay? All right, and if you need help with that, like if that happens, definitely let me know, because I can help you with that by getting some stool softeners, okay? And we'll try to make sure you increase your fiber too, okay? All right, let me listen to your bowels real quick. All right. All right, bowel sounds were heard. They are active. Active bowel sounds. Okay. Alrighty. So let's go ahead over here. I'm gonna go to your legs, and I'm just checking for any swelling on one leg more than the other. Any heat? Okay, on one leg more than the other. Nothing. Okay, perfect. And then here for edema. Nope. Okay, perfect. All right, and how are you doing with baby bonding? How are you doing? Like every time you hold baby, every time she cries? Yes? Okay, awesome. You love her so much? Oh, okay. Aw, you don't want to let her go? Okay. But just so you know, when you get sleepy or you're trying to, like, you fall asleep, you feel yourself fall asleep, please put baby in the bassinet. We don't want to drop her, okay? All right. And any signs of like depression, of sadness, random sadness? No? Oh, okay, that's perfect. Okay. We will be assessing that throughout your stay here. But that's good to know right now you don't. Okay, perfect. And then let's see here. Rogam. You don't need Rogam, but if you did, you would have had a blood type that's negative, but yours is O positive, so we don't gotta worry about that. But if you had like a O negative and baby had, let's say, O positive, then we'd give you an injection called Rogam, and that's because of the antigens of the blood type. The antigens there, the antibodies are like fighting the blood cells and stuff like that. But don't worry about that, okay? Alrighty. Do you need anything from me? Water, ice? No? Okay. I'm gonna go ahead and go. If you need me, give me a call. Do you want me to turn off your lights? Okay. Perfect. All right. Let me know if you need anything.